If you're experiencing persistent shoulder pain, weakness, or difficulty lifting your arm, you might be dealing with a rotator cuff tear. This common injury affects millions of people, from athletes to older adults, and can significantly impact daily life. Whether it's caused by wear and tear over time or a sudden injury, a rotator cuff tear can make simple activities like reaching overhead, lifting objects, or even sleeping comfortably a challenge. But the good news is that with the right diagnosis and treatment, many people regain function and find relief from pain. In today's video, we're going to take a deep dive into everything you need to know about rotator cuff tears, what they are, what causes them, how to recognize the symptoms, how they're diagnosed, and the different management options available. Hi, I'm Dr. Knapp, family medicine physician, here to bring you medical information so you can take control of your health and make the most of your doctor visits. Let's get started. The rotator cuff is a group of 4 muscles and their associated tendons that surround the shoulder joint. These muscles work together to stabilize the shoulder and allow for a wide range of motion. When one or more of these tendons tear, either partially or completely, it leads to a condition known as a rotator cuff tear. This can result in pain, weakness, and difficulty with arm movement. Rotator cuff tears generally fall into 2 categories: acute tears and degenerative tears. Acute tears usually occur from a sudden injury, such as falling on an outstretched arm, lifting something too heavy, or experiencing a direct blow to the shoulder. These are more common in younger, active individuals, particularly athletes and those involved in physically demanding jobs. Degenerative tears, on the other hand, develop gradually over time due to repeated stress and natural aging. These are more common in older adults and people who engage in repetitive overhead movements, such as painters, carpenters, and tennis players. Several risk factors increase the likelihood of developing a rotator cuff tear. Age is one of the most significant factors. People over the age of 40 are at a higher risk due to the natural weakening of the tendons over time. Repetitive overhead activities, whether through sports like baseball and swimming, or occupations like construction and painting, can put constant strain on the rotator cuff, leading to gradual damage. Poor posture, particularly forward shoulder positioning, can also contribute by increasing stress on the tendons. Smoking has been linked to decreased blood supply to tendons, making them more prone to degeneration and slower healing. Additionally, a history of previous shoulder injuries or conditions such as tendinitis increases the risk of developing a tear. So how do you know if you have a rotator cuff tear? The most common symptom is persistent shoulder pain, particularly when lifting the arm or reaching behind the back. The pain often starts gradually, but in the case of an acute tear, it can be sudden and severe. Many people describe difficulty with everyday activities like combing their hair, reaching into a cabinet, or even putting on a jacket. Weakness in the affected arm is another hallmark symptom, making it hard to lift objects or maintain strength in certain positions. Some individuals experience a cracking or popping sensation known as crepitus when moving the shoulder. Nighttime pain is also common, and many people report that sleeping on the affected side worsens their discomfort. In the case of a complete tear, the pain and weakness can be so severe that lifting the arm becomes nearly impossible. This is why early recognition of symptoms and seeking medical evaluation is crucial. Ignoring a tear can lead to worsening damage and decreased shoulder function over time. If you suspect a rotator cuff tear, a doctor will begin by asking about your symptoms, medical history, and any previous shoulder injuries. A physical examination is essential in assessing shoulder strength, range of motion, and areas of tenderness. Common tests include the drop arm test, where the patient is asked to slowly lower their arm from an elevated position. If the arm drops uncontrollably, it may indicate a tear. Another test, the empty can test, involves holding the arm out from an angle while resisting downward pressure. Pain and weakness during these movements may suggest a rotator cuff tear. To confirm the diagnosis, imaging studies are often needed. An X-ray can help rule out other shoulder conditions such as arthritis or bone spurs, though it doesn't directly show a rotator cuff tear. An MRI is the gold standard for diagnosing rotator cuff tears, as it provides detailed images of the tendons and surrounding tissues, showing the size, location, and severity of the tear. In some cases, an ultrasound may also be used as a quick and cost-effective way to assess tendon damage. Once a diagnosis is confirmed, treatment depends on the size of the tear, the severity of symptoms, and the patient's activity level. For many people, non-surgical options provide significant relief and help restore function. Rest and activity modification are important. Avoiding movements that worsen symptoms can prevent further strain on the shoulder. Ice and anti-inflammatory medications like ibuprofen or naproxen can help reduce pain and swelling. Physical therapy is one of the most effective non-surgical treatments. A structured rehabilitation program focuses on strengthening the surrounding muscles, improving flexibility, and restoring shoulder stability. A physical therapist may guide patients through exercises to gradually regain strength and range of motion while avoiding excessive strain. Corticosteroid injections may be recommended for persistent pain, providing temporary relief by reducing inflammation. However, repeated injections should be used cautiously as they can weaken the tendon over time. For those with large or complete tears, or when non-surgical treatments fail, surgery may be necessary. There are several surgical options depending on the severity of the tear. Arthroscopic surgery is a minimally invasive procedure where small instruments and a camera are used to repair the tendon through tiny incisions. This approach results in less scarring and a quicker recovery compared to open surgery. In more complex cases, open surgery may be required, involving a larger incision to fully repair or reattach the torn tendon. In cases where the rotator cuff is severely damaged and beyond repair, a tendon transfer or shoulder replacement may be considered. I just want to take a moment to ask that you hit that like button and subscribe to my channel. Leave a comment below if you have any questions or topics you want covered in future videos. Anyway, recovery from rotator cuff surgery varies depending on the type of procedure and the extent of the tear. In general, rehabilitation is a crucial part of the healing process. Initially, the arm is immobilized in a sling for several weeks to allow the tendon to heal. Physical therapy is gradually introduced to restore movement and strength, starting with gentle passive exercises before progressing to active strengthening. Full recovery can take anywhere from 4 to 6 months, and in some cases up to a year. Patience and adherence to the rehabilitation guidelines are a key to achieving the best outcome. While not all rotator cuff tears can be prevented, there are steps you can take to reduce your risk. Strengthening the shoulder muscles through targeted exercises helps provide better support and stability. Avoiding repetitive overhead movements and maintaining good posture can also minimize strain on the rotator cuff. If you're involved in sports or activities that require frequent shoulder use, proper warm-up techniques and gradual conditioning are essential. And of course, if you ever experience persistent shoulder pain or weakness, seeking medical attention early can prevent further damage and improve recovery outcomes. To sum it up, a rotator cuff tear can range from mild to severe, causing pain, weakness, and limited shoulder movement. While some tears heal with non-surgical treatments like physical therapy and pain management, others require surgical intervention. Early diagnosis and proper rehabilitation are key to a successful recovery. If you've been struggling with shoulder pain, don't ignore it. Getting the right care can make all the difference. Thank you for watching. As always, take care of yourself and make the most of your day.